we are on to the next startup. This is about Nano Detector, and Anam is here. Anam, let's play your video.
Assalamu alaikum everyone, I'm Dr. Anam Munawar, currently working as an assistant professor in the Department of Forensic Sciences at University of Health Sciences, Lahore. If I talk about the medical industry of Pakistan, specifically with reference to the diagnostic procedures, then these procedures are highly expensive, required expert person and expensive equipments. And an ingenious idea is this: when any pathogens enter in a human body, there are some kind of physiochemical changes. If we will be able to detect those changes at an early stage, we can increase the survival rate. Here at Department of Forensic Sciences, we are working on the development of nanomaterials which can be used for the detection of these physiochemical changes, and later we use these nanomaterials on the development of lateral flow strips. These strips are able to detect any disease at an early stage with a cost-effective manner and on spot testing. And due to the development of color line, any lay person will be able to read out the result. If we compare this method with the conventional methods like PCR and ELISA, then this method is cost effective, and even a layperson is able to read out the results. No pre-sample processing is required for that. And if I talk about myself, then I have participated 2 times in the National Incubation Center Hepatitis C Hackathon and the Agricultural Hackathon. We got the money from there. Then I have participated in the National Idea Bank on the basis of Nano Detectors idea. We have also participated in the Taxonomy Challenge, which was organized by the British Council, and we got money from there. And nowadays we are working on the detection of hepatitis C, and we have developed such kind of devices which can be used for the detection of hepatitis C at an early stage. And for Aspire, I would like to say it's a really good initiative to support such kind of ideas which can bring a change, which can bring a positive change. Thank you so much.
Okay, let's stop that. Let's bring here Anam. Anam, if nothing else, you should learn from this experience. There's something, use of a pause.
Assalamu alaikum everyone. Can you hear me?
Can you hear me?
Yeah.
Because if you learn to pause,
Okay.
you'll be heard much more easily by people. So you have to learn the power of the pause. Please go ahead and explain what we should know.
Okay. Assalamu alaikum everyone. I'm Dr. Anam Munawar, currently working as an assistant professor in the Department of Forensic Sciences at University of Health Sciences, Lahore.
Focus on that.
Okay, we are working on the fabrication of nanomaterials, and these nanomaterials used for the detection of different kind of analytes. Analytes like hepatitis C. Right, till now we have worked with the hepatitis C. Next, we are trying to move towards the cancer detection. Actually, the idea is. Actually, the time is short, sir.
I know, but if you say like this, nobody understands anything. It's total waste of your time and our time. What's the point?
Okay. Okay. The idea is this: when any pathogens enter in a human body, there are some kind of physiochemical changes. If we will be able to detect those changes at an early stage, we can detect any disease.
No, hold on. You're going unnecessary thing. What's the accuracy? What stage is the company? How much money do you need? Answer those 3 questions.
Okay, so we need 3.5 million PKRs, Pakistani rupees, and we are at the stage of like we have developed all the things, but we don't have the setup to develop those portable devices. We are working on the fabrication of portable devices. Until and unless we will be able to make such kind of devices, we will not bring those devices into the market. We have worked with the Allied Hospital. We collect real samples from there and use those devices for that purpose, and for the Kershi industries as well. But we don't have the setup to bring these devices to make at a large scale.
Okay. Any questions from the jury? Umair, I know you have a question. Let's see if anybody else does.
Can I ask Zafar sir?
You bilkul.
Anam, does it need the regulatory approval? And what is the standard, and who will certify your product? Because I'm ready to finance or to sponsor your product, but I need the standard certification and regulatory approval clearance. A clear idea about this in very short.
Okay, sir. It's like this, that it worked just like the portable devices. For this devices to bring into the market, we don't need such kind of certification for that. But before bringing that device into the market, we have to set up our own parameters like sensitivity, selectivities. ये parameters हमें खुद set up करने पड़ते हैं. We have already done these set up these parameters. हम इनको devices को already जो है वो हम इसके ऊपर study कर चुके हैं. for hepatitis C. Now we are moving towards the cancer.
Cancer, we heard
Anam,
that.
that
Yeah,
is
yeah, yeah.
Can
that
I?
is yours.
Yeah. Guys.
That is
Javed,
your standard against your standard. I'm ready to buy this product and sponsor you, but I will discuss with you later on. I think this
one-on-one
is
करना
very
है।
short.
जी
one-on-one करना
थोड़ा
है,
सा
हाँ।
जी
उमर, आपने कुछ कहना था? Malik Umair? Okay, Malik Umair is confused. So Hasan Saab, you go ahead.
अच्छा जी फर्स्ट ऑफ ऑल अनम माशाल्लाह वेरी गुड वेल डन जो आप कर रही हैं दैट्स जस्ट अमेजिंग इसके अंदर जो एक्यूरेसी का क्वेश्चन था जो आपने हेपेटाइटिस सी के ऊपर आपने जैसे कहा कि हमने सैंपल्स लेके किया तो उसमें आपकी क्या एक्यूरेसी थी
सर इट्स लाइक दिस, ये आपको यस और नो में आंसर दे रहा है। हम जो राइट नाउ हम हेपेटाइटिस सी
परसेंटेज
के
बता
लिए
दें बस
ये हम जो हेपेटाइटिस सी के लिए क्लेम कर रहे हैं दैट इज अबाउट 98%। हम लोगों ने रियल सैम्पलिंग एप्लीकेशन भी की हुई है फॉर दैट एज वेल।
Advice for you, that should be in your slide. This should be the first thing coming out of your mouth.
This is amazing. I mean 98% accuracy, you should be shouting.
Exactly.
You know.
We have to extract it out of you with so much difficulty.
Yeah.
आपका कौन है मेंटर?
Very
इससे
good.
बात करनी पड़ेगी। यार अनवर मदद कर यार बेचारी अनम की।
Inshallah. I think that's it's amazing what you can do. Just one question is for a test strip, how much would it cost to the consumer?
Okay. For consumer, it will be like this. For manufacturer, if I talk about that, then at massive scale, it will cost around about 10 to 12 rupees Pakistani, and it's up to us that how much we are going to cost for that.
Excellent. I think that's it. Really can be widely distributed, and consumers they can use it and to
Yes,
determine
the plus point is this, that no doubt there are already many devices are available in the market, but that are based on the antibodies. जो manufacturer है उसको antibodies raise करनी पड़ती हैं और raise करने के लिए इसको कोई ना कोई lab animal use करना पड़ता है. Here we are manufacturing the nano materials which are just like antibodies. वो antibodies की तरह act करते हैं. हमें कोई lab animal कोई model ऐसा use नहीं करना पड़ता.
Okay,
Great.
we have a few seconds left. Any last comments or question?
Do you have any other
Very
team
good.
members with you, or you are alone? You did not
No,
extend
we have a whole department in that. We have collaboration with National Institute for Biotechnology and Genetic
आपकी कंपनी में
Engineering.
कितने लोग हैं? आप कंपनी में अकेली हैं क्या कोई और भी हैं?
No, it's like this, that we have 10 members at there, and I have provided the
You're talking about department. Department is not a company. We don't invest in department. We invest in companies. Company में कितने लोग हैं?
Those are based on those.
My answer to my question is the integer.
हाँ मेरे ख्याल में इनकी कंपनी अभी बनी नहीं है.
अच्छा,
If
बनी
I'm
नहीं है.
not
It's not a
mistaken,
registered company. It's not a registered company.
Registered, I don't care about. कंपनी में एक लोग है. अगर आप अकेली काम कर रहे हो तो have a very different answer. आपके पास 6
No,
लोग हैं,
sir.
have a
No,
different
sir.
answer.
No. It's not like this that we are working on the based on one member. I have a whole team and I have given the information.
So, चलें. But guys, we have a link in the chat. You can put comments there. You can collaborate with the company.